Hi everyone, this lesson is on the side effects of amlodipine. So we're going to talk about what amlodipine is, and then we're going to get into the side effects of amlodipine use, and then we're going to talk about some things that you can do to help reduce some of the side effects that can occur from amlodipine use. So what is amlodipine? Amlodipine is also known as Norvasc. It is a medication used to reduce blood pressure. And in doing so, it reduces the risk of cardiac complications and strokes. Now, amlodipine is actually a calcium channel blocker, and what it does is it reduces the blood pressure by blocking what are called voltage-dependent L-type calcium channels. And by doing that, it inhibits vascular smooth muscle contractility, increases smooth muscle relaxation, and causes vasodilation. So all of that really means is that it acts on your arteries and your veins to increase their diameter, so causes vasodilation, essentially lowering the blood pressure. So if there's not as much squeezing onto the blood inside the vasculature, there's going to be a lower blood pressure. And in doing that, it actually improves cardiac functioning. And not only is it used to reduce blood pressure, but it may also be used to treat anginal chest pain or chronic stable angina. However, amlodipine use may cause a variety of mild and or severe side effects. Most of the side effects are going to be rare, but we're going to talk about all of them and the likelihood of getting them in the next upcoming slides. Let's first talk about the most common side effect of amlodipine use, and that is edema. So again, this is actually one of the most, if not the most common side effect of amlodipine use. This is the textbook side effect. When you learn about amlodipine, we learn about peripheral edema. It likely affects more than 10% of patients. And what this is peripheral edema, which is swelling of the extremities. So legs and feet, and oftentimes it's going to be the ankles that become swollen. This occurs in a dose-dependent manner. So the higher the dose of amlodipine, the more likely edema is going to occur. And a way to help reduce some of the edema is by mobilizing. So walking around and being active can move some of that fluid out of the interstitial space, allowing the swelling to reduce. Another common side effect of amlodipine use is a headache. It's going to be a tension type headache. So it's going to be more of a band around the head, and oftentimes it's going to be a bilateral pain. This is likely to occur in approximately 7% of patients on amlodipine. This is often a temporary side effect. So often within the first few days of using amlodipine, we can see this as a side effect. And although tension headaches may be a potential side effect of amlodipine use, amlodipine can be used for migraine prophylaxis. So amlodipine can be used to reduce the risk of having migraine headaches, especially in those that are very prone to migraine headaches. So I also want to mention this as an interesting point. Another side effect of amlodipine use is fatigue. So this is another more common side effect. So feeling tired and drowsy can occur. It's likely to occur in about 4 to 5% of patients. And along with this, excessive daytime sleepiness or somnolence may also occur as well. We can also see nausea occurring in some patients on amlodipine. This is likely to occur in roughly 3% of patients, and it may be accompanied by abdominal pain, which is less common to occur. It's likely that it occurs in 1% or less of patients who are on amlodipine. Flushing is also another side effect that can occur with amlodipine use. So skin reddening or flushing can occur, oftentimes occurs in the face and the neck area. This is also likely to improve within a few days, so it's a temporary side effect oftentimes. It's estimated to occur in 1 to 3% of patients, and this too is also dose dependent. So as the dose of amlodipine increases, you're more likely to have this as a side effect. Heart palpitations can also be another side effect of amlodipine use. So a patient may feel that their heart skips a beat. And other arrhythmias may also occur as well, including atrial fibrillation, although they are very rare and occur in less than 1% of patients. The heart palpitations themselves, that feeling of the heart skipping a beat, may occur in up to 4.5% of patients. And again, this too is also a dose-dependent effect. Skin rashes can also occur with amlodipine use. We can see petechial rashes occurring with amlodipine use. So petechiae are little spots of red, so superficial bleeds under the skin. And this can occur in approximately 1 to 2% of amlodipine users. And then pruritus, which is a sensation of itching, can also occur with amlodipine use, and this likely affects 1 to 2% of patients as well. Weakness is also another side effect, so this is also known as asthenia. Muscle weakness can occur, and again, this is roughly 1 to 2% of patients on amlodipine. And then myalgias can also occur with amlodipine use, so this is where muscles ache and feel crampy, and they may be tender to touch as well. And again, this is estimated to affect 1 to 2% of patients. Hypotension or low blood pressure can also occur as a side effect of amlodipine use. So because amlodipine causes vasodilation and causes the blood pressure to decrease, if there is too high of a dose of amlodipine, this can cause the blood pressure to decrease too much. So this can cause hypotension. And another important point to make note of here is that interactions with other medications can increase the risk of having hypotension. So using antibiotics, particularly the macrolides like azithromycin and clarithromycin, if they're used when a patient is on amlodipine, they can interact with amlodipine to increase the risk of hypotension. So that's also important to make note of as well. And if a patient does have issues with hypotension, it's important to reduce the dose that they're on. Dizziness can also affect some patients as well. So presyncope, which is a feeling of dizziness or lightheadedness, and possibly syncope, which is fainting. These can both occur. This is likely due to the hypotension or the low blood pressure. And in order to reduce the risk and possibility of falling from dizziness, it's best to slowly stand or sit up. So if you're sitting or lying down, it's best to slowly get up so you don't have significant postural hypotension that can also lead to you possibly falling. So important to slowly get up from sitting or lying down. And dizziness is also a dose-dependent feature as well. And then sexual dysfunction is also another side effect of amlodipine use. This occurs in male patients. It's erectile dysfunction, and it may occur in roughly 1% of patients on amlodipine. Now, those are the most common side effects that can occur with amlodipine use, but there are many, many others that are very, very rare. I want to touch on several more severe side effects, but having said that, the side effects I'm going to talk about here are not the only ones that can occur. There are many other small, minor side effects that can occur, but they are very, very rare, and we won't talk about them in this lesson. But here are a few more severe side effects that can occur, and again, they are very rare. One of them is heart failure. So heart failure can be a very severe and very, very rare side effect of amlodipine use. Pulmonary edema can also be a very severe and very rare side effect as well. We can also see acute kidney injury being a very severe and rare side effect. It's important to note that the risk of an acute kidney injury increases with the concomitant use of macrolide antibiotics, again, like azithromycin and clarithromycin. So if using those in combination with amlodipine, these can not only increase the risk of hypotension, as we mentioned earlier, but they can also increase the risk for an acute kidney injury. Liver disease is also another potential risk factor of amlodipine use. This is what is known as idiosyncratic drug-induced liver disease. Very, very rare, but it can occur as well. And then rhabdomyolysis is also something else that can occur. But this is going to occur more often in patients who are on statin medications. So statins have their own risk of myalgias, myopathy, and rhabdomyolysis. But when a patient is also on amlodipine and on a statin, they are at an even higher risk of rhabdomyolysis. So those are a few important points to make note of, which increase the risk of certain side effects that occur with amlodipine use. And we talked about some other modifications that you can do to reduce some of the risks of side effects earlier on in this lesson, like mobilizing to reduce the side effect of peripheral edema and getting up very slowly from a sitting or lying down position. If you want to learn more about other side effects from other medications, including metformin, please check out my lessons on those topics. And if you haven't already, please like and subscribe for more lessons like this one. Thanks so much for watching, and hope to see you next time.